As the 115th Congress comes to an end, I thought it was important to reflect on some of the progress we've made for Oregon's 2nd District over the last couple of years. I think we made historic strides in the fight against the opioid crisis, which takes the lives of more Oregonians than traffic accidents. Throughout our district, I heard from families, from victims, and those on the front lines of combating opioid abuse in Oregon. Our bipartisan legislation, known as the Support for Patients and Community Act, was signed into law in October. It provides new tools and resources to help stem the tide of the opioid addiction and save lives. We also passed into law the most significant reforms to forest management in more than a decade. They include fixing the way we pay to fight forest fires so that we aren't robbing forest management funds to pay for firefighting costs. So beginning in 2020, we will finally treat wildfires like the natural disasters that they are. There's more to be done to protect our communities from smoke and fire, but this is important progress toward that goal. I'm also proud of the work we did to strengthen public health programs, upon which so many Oregonians rely. I worked hard to pass the law that historically extends the Children's Health Insurance Program for 10 years, fully funded, and it boosts funding for community health centers as well. Both of these programs provide crucial health care to people across our district and across America. And the resources Congress provided will ensure these programs can continue to serve those people and communities. And bipartisan measures I helped pass into law will help boost hydropower production in Oregon and across the country, connect rural areas of our district with high-speed broadband, and give communities resources to put old industrial sites back into economic use through the Brownfields program, which is, by the way, being used in places from Grants Pass to Bend to Pendleton. Most importantly, we provided our veterans with unprecedented resources and help so they can get the care and support they deserve and earned at the VA. That includes our legislation to bring medical scribes into the VA so that doctors are not burdened by paperwork and can spend more of their time actually talking to and caring for our veterans. And when we boosted funding for our military to give them the tools they need to safely carry out their missions, they'll be better able to defend freedom around the world. I look forward to continuing this bipartisan progress in the next session of Congress. There's so much more to be done to improve forest management and to reduce catastrophic wildfires that choke our communities with smoke. After another devastating wildfire season across our state, we need to redouble our efforts to save our forests and our communities from fire and destruction. We should be using the proven management tools that work in eastern Oregon forests in all of Oregon's forests. When they're losing towns and people and firefighters and our communities are choked with smoke, we need to do a better job in the way that our forests are managed. We also must continue our efforts to increase transparency and patient control in our healthcare system, which will help bring down drug costs. And I'll continue to look for solutions to help connect rural communities with the 21st century economy and crack down on the bad actors contributing to the spread of the opioid crisis. None of this is possible without the feedback and your input of the people on the ground in our district. Through roundtable meetings, in-person and telephone town halls, and more than 168,000 messages responded to, I've added a lot to my to-do list over the last couple of years. But I'm committed to adding more to that to-do list in the upcoming session of Congress as I continue to reach across the aisle to solve problems and get real results for the people of our district. Thank you, and God bless.